In this video, you'll see the placement of a full arch bridge on 3 types of multi-unit abutments. The standard version with a tall cone, Multima Pro, and Multima CRESTFIT. Fixation of the prosthesis on the Multima multi-units is performed using the specialized Skaversky protocol. This demonstration highlights the advantages of the Multima system over other solutions. Let's get started. This is a full arch bridge. Before placing it, I used a round burr to create retentive grooves for better adhesive bonding. In this case, it's acrylic, but we follow the same protocol with zirconia before sintering. Let's look at the advantages of the Multima multi-units. This model includes CRESTFIT Multima, Multima Pro, a standard angled unit with a tall cone, and a straight unit with a tall cone. To make things clearer, we removed the gingiva mask. Now the differences between the multi-units become apparent. Here we have 3 types of sleeves and screws that will be cemented into the bridge. This complexity is often why even highly experienced surgeons who perform advanced surgical procedures avoid this part of the workflow. But in reality, it's not complicated. I'll show you how it works. Keeping the workspace organized is essential. We've grouped the multi-units into first and second segments. We also have the adhesive ready, along with a cloth to remove any excess. To avoid confusion, I marked the sleeves with a marker. I labeled 2 CRESTFITs. I know this setup includes conical sleeves and 1 pro sleeve. Why are 3 screws already mounted on drivers? Because standard multi-units require a large access hole in the bridge for screw placement. For Multima sleeves, we use smaller access holes that do not allow screws to fall out during placement. This makes the process more secure and efficient. The first step is attaching the sleeve to the distal multi-unit. It acts as a guide for bridge placement and ensures accuracy, especially critical intraorally, where conditions are more challenging than on a model. We seat the bridge onto this guide sleeve. This gives us our initial position. Now everything is ready to begin. We start bonding the sleeves, first the ones without screws. This one is a master sleeve, so it doesn't require bonding. Once everything is prepped, the process is quick. We remove excess adhesive. This particular sleeve already contains a screw, and I marked it. There's no risk of it falling out. We find the position. Here's a crucial tip. When bonding sleeves, do not lay the bridge flat on the table. Hold it in your hands and insert the sleeves horizontally. This prevents screws from dropping. Here's a sleeve for the straight pro unit. Apply adhesive generously. Its cylindrical design ensures adhesive doesn't enter the screw hole. Nothing will fall out. We place the bridge onto the master unit and adjust until everything seats correctly. The screw is pre-mounted, which simplifies the process. These screws were already loaded. Now we verify that all sleeves are properly seated. For demonstration, we removed the gingiva mask. The next step is thoroughly curing each crown from both sides. We then confirm that all sleeves are bonded and positioned correctly. One sleeve is still unbonded, so we remove the bridge. I always unscrew the anterior teeth last to prevent the structure from shifting. In this case, I removed the last screw, which can't fall out due to the small access hole. It remains inside the bridge. This is the result so far. Next, we bond the master sleeve and retighten everything. We adjust the area around the sleeves, thinning the zirconia or acrylic if needed, and the bridge is ready. Now we bond the final sleeve. Nothing falls out, as it contains no screw. Screws in sleeves with small holes are secure and cannot drop out. We reposition the bridge. Screws are preloaded onto their drivers. Note again the screw angle provided by the standard Pro multi-unit. We light cure the last crown from all sides. The work is now complete. Let me show you how we check for passive fit. We leave only one screw in place. We remove the first screw, then the second. You'll hear distinct clicks as the screws disengage. If you're listening to music or TV, you might miss those sounds. You'll notice the bridge still fits precisely everywhere, even though it's retained by just one screw. Because it's made of acrylic, the bridge has some flexibility. If you pull it slightly, it moves but returns to place. This is about as passive as a fit can get. Now we remove the last screw and take off the bridge. Let's analyze how precisely the sleeves are seated in the crowns. 3 conical sleeves. The first one is seated perfectly. The second fits well on one side, but not as well on the other. This one protrudes slightly. The next is seated properly. One sleeve is extended by about 0.1 millimeters. Another is slightly uneven on one side. This suggests a minor inaccuracy during scanning or milling, or some tension within the bridge. Because we polymerized directly on the multi-units, we now have a passively fitting bridge. Now we place the gingiva mask on the model to highlight the advantages of the new CRESTFIT multi-units. With the gingiva mask in place and the bridge seated, we can immediately see the difference between the CRESTFIT and standard multi-units. With the standard unit, we can't fully close the zirconia. CRESTFIT units in the molar region rest flush against the soft tissue. It's also difficult to approach angled multi-units in CAD modeling, which can leave a visible gap. In this case, we used a standard screwdriver because the angulation wasn't critical. However, if we needed more angulation to reposition the screw channel, we could use a specialized driver capable of up to 35 degrees. That additional range is extremely valuable. Thank you for your attention.